Welcome back. Over 10 years ago, the first family-owned and operated American Vein and Vascular Clinic opened in Pueblo, Colorado. And since then, they have opened 7 additional facilities in our state that are a world-class network of vein and arterial diagnosis and treatment centers helping those in need. Founder Dr. Gordon Gibbs recently sat down with us. Take a look. Dr. Gibbs, I'm so glad you're here.
Good morning, thank you.
Tell us a little bit more about the American Vein and really how it got started.
Yeah, so we started about 10 years ago, as you mentioned, really out of a need. We saw that there were a lot of people with vein problems out there that really didn't have access to great care. And the technology in vein care has really come a long ways during that time. And so the historical norm of vein stripping really isn't something that applies to us. There's a lot better technology. It's much less invasive than it used to be. And the treatment outcomes are just much better than they used to be. So it was really born out of a need.
Talk about some of the symptoms of venous disease that maybe some people just don't even know about.
Yeah, sure. So some of the common things that people present with are going to be swelling, aching, cramping, heaviness in their legs, more so towards the end of the day. Sometimes people have nighttime symptoms like cramping and restlessness. They can either wake them from a sleep or they can prevent them from going to sleep in the first place.
Talk about the exam that is really needed to see this and to figure this out.
This is one of the things that I think has really made vein problems a lot more different now than they were historically, is really the ultrasound exam. So an ultrasound is a tool that we use pretty commonly in the clinics that allows us to see exactly what's going on the inside of the veins. And so some of them are healthy and normal, some of them are abnormal, and it's those abnormal ones that we really want to pinpoint, identify, and potentially treat, because those are the ones that are causing the symptoms.
Those are the ones. Talk about how long an ultrasound exam actually, takes for that, and really what does that consist of?
Sure. Well, I'm glad you asked, because that's one of the things I feel like really sets our clinic apart from some other practices out there, is really the detail that we apply to that ultrasound. So an ultrasound exam in our office takes about 60 to 90 minutes. And we look at the patient laying down flat, we look at them standing, we look at them in between, because the veins behave differently with the patient in different kind of orientations. So, you might go to another practice and they might spend 15 to 20 minutes or so. And I feel like getting that detailed ultrasound up front is really what allows us to create the best treatment plan so that people have a great outcome.
All right, Registered Vascular Technologist. I was saying right before we came on what a great title that is,
yeah,
right?
Yeah, an RVT.
RVT. Can you talk about the training that they get and really what they do?
Yeah, so as I mentioned, ultrasound machine is something that we use in most of our patients, and an RVT, or a Registered Vascular Technologist, or Registered Vascular Sonographer, is somebody who has specific training on using that machine, and specifically looking at blood vessel problems, whether they be arteries, whether they be veins, whether they be the heart, whatnot. So we can basically have hired people who are really good at running those machines and who really know the nuances of identifying vein problems so that we can come up with the best treatment plan.
You mentioned it a little bit, but let's go into it a little bit further and talk about how your ultrasounds really are different than the competition or anyone else out there.
Yeah, so it really comes down to the detail. So our sonographers, this is what they do all day, every day, and they're very good, they're very capable, and I feel very proud in the team that we've assembled, because that really does help set us apart from somebody who might be dabbling in vein care or a smaller practice or whatnot. Is just the depth of expertise that we have on our team is really second to none, I believe, in Colorado, if not the country.
Wow. Well, that is good to know. That's something that's so precise in what you're doing. Do you also scan, and I'm going to read this off here so I don't get it wrong, it's arterial disease or DVTs, right?
Sure,
we do that as well, right?
So it's all, we want to identify if somebody has a problem with their circulation. So a circulation problem can be arteries, meaning delivering blood down to the feet. It can be veins, meaning bringing blood back to the heart. So if you have a blockage like PAD, sometimes people have heard that, is a blockage in the arteries going down to the feet. That can cause a certain spectrum of symptoms. If you have a problem with the veins bringing blood back to your heart, that can cause a different spectrum of symptoms. So we really try and identify, is it just arteries? Is it just veins? Is it a mixed pattern? And with that information, we can provide the best recommendations.
Dr. Gibbs, we appreciate you coming in. Thank you so very much. Love your legs again. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. Call their number today at 8445-MY-LEGS. That's 844-569-5347. Or visit them at AmericanVein.com for more information. They paid for today's segment.